White Petrolatum-Mineral Oil Ointment is used to relieve dry, irritated eyes caused by various factors such as wind, sun, heating/air conditioning, computer use/reading, and certain medications. This product may contain ingredients such as carboxymethylcellulose, dextran, glycerin, hypromellose, polyethylene glycol 400, PEG 400, polysorbate, polyvinyl alcohol, povidone, or propylene glycol, among others. It helps to keep the eye moist, protect the eye from injury and infection, and decrease symptoms of dry eyes such as burning, itching, and feeling as if something is in the eye. It is important to use it according to the dosage instructions provided by your healthcare professional. The best time to take this medication is as directed by your doctor or pharmacist for the most effective relief. When using White Petrolatum-Mineral Oil Ointment, it's important to follow the directions on the product package. If you have any questions, ask your doctor or pharmacist. Do not use a solution that has changed color or is cloudy. Some eye drops need to be shaken before use, so check the label to see if this applies to your product. Usually, drops may be used as often as needed, while ointments are usually used 1 to 2 times daily as needed. If using an ointment once a day, it may be best to use it at bedtime. To apply eye ointment/drops/gels, wash your hands first and be careful not to touch the dropper or top of the ointment tube to avoid contamination. Always replace the cap tightly after each use. Tilt your head back, look up, and pull down the lower eyelid to make a pouch. For drops/gels, place the dropper directly over the eye and squeeze out 1 or 2 drops as needed. Look down and gently close your eye for 1 or 2 minutes. Place one finger at the corner of the eye near the nose and apply gentle pressure. For an ointment, hold the tube directly over the eye and gently squeeze a small strip, 1/4 of an inch or roughly 6 mm, of ointment into the pouch. Release the eyelid, close the eye, and slowly roll your eye in all directions to spread the medication. Blot away any extra ointment from around the eye with a clean tissue. If you are also using another kind of eye medication, wait at least 5 minutes before applying other medications. Use eye drops before eye ointments to allow the eye drops to enter the eye. If you wear contact lenses, remove them before using most kinds of eye lubricants. Ask your doctor or pharmacist when you may replace your contact lenses. There are a few types of eye lubricants that can be used while wearing contact lenses, so check the package to see if you can wear your contact lenses while using your product. Tell your doctor if your condition lasts or gets worse after 3 days. When using White Petrolatum-Mineral Oil Ointment, you may experience temporary blurred vision and minor burning, stinging, or irritation. If these effects persist or worsen, seek medical advice promptly. If your doctor has prescribed this medication, they have determined that the benefits outweigh the potential side effects. Most people using this medication do not experience serious side effects. However, you should contact your doctor immediately if you experience any serious side effects such as eye pain, changes in vision, or continued eye redness and irritation. While a severe allergic reaction to this medication is rare, seek immediate medical help if you experience symptoms such as rash, itching, swelling, especially of the face, tongue, or throat, severe dizziness, or difficulty breathing. This is not a complete list of possible side effects. If you notice any other effects not mentioned here, contact your doctor or pharmacist. In the U.S., you can report side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can report side effects to Health Canada at 1-866-234-2345. Before using White Petrolatum-Mineral Oil Ointment, make sure to inform your doctor or pharmacist about any allergies you may have. This ointment may contain inactive ingredients that could cause allergic reactions or other issues, so it's important to discuss this with your pharmacist. If you have any existing health concerns, it's best to consult with your doctor or pharmacist before using this ointment to ensure it's safe for you. After applying the ointment, you may experience temporary blurred vision, so it's advisable to avoid activities that require clear vision until it's safe to do so. When using White Petrolatum-Mineral Oil Ointment, it's important to be aware of potential drug interactions. These interactions can affect how your medications work and may increase your risk for serious side effects. It's important to keep a list of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and share this list with your doctor and pharmacist. Before making any changes to your medication dosage, always seek approval from your doctor. If this ointment is swallowed, it can be harmful. If someone overdoses and experiences severe symptoms like passing out or difficulty breathing, it's important to seek immediate medical attention. In the U.S., you can call the local poison control center at 1-800-222-1222, and in Canada, you can call a provincial poison control center. Now let's talk about the uses of white petrolatum-mineral oil ointment. This ointment is commonly used to help protect and soothe minor cuts, scrapes, and burns. It can also be used to help prevent and treat diaper rash and other minor skin irritations. It's important to follow the directions on the product package or as directed by your healthcare professional. Be sure to talk to your healthcare professional if you have any concerns about using this ointment. So, when it comes to using white petrolatum-mineral oil ointment, it's typically used on an as-needed basis. This means that you should apply it whenever you feel the need for relief from dry, chapped, or irritated skin. It's most commonly used for conditions like eczema, psoriasis, and minor burns. And you can apply it as often as needed to keep your skin moisturized and protected. Just be sure to follow the directions provided by your doctor or pharmacist for the best results. Make sure to check the storage instructions on the package and keep the ointment from freezing. If you are using preservative-free drops that come in single-use vials, make sure to discard them either immediately after use or within 12 hours of opening. Check the product package for specific instructions. Keep all medications away from children and pets. When it comes to discarding the product, do not flush it down the toilet or pour it into a drain unless instructed to do so. Make sure to properly discard the product when it is expired or no longer needed, and consult your pharmacist or local waste disposal company for guidance. If you need more help, call your doctor for medical advice. In the U.S., you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.